Have you just gotten your calcium score test results, but you're confused about what those numbers really mean? Let me break it down for you in simple terms. Hi everyone, welcome to the channel. Today we're going to break down how to understand your calcium score test results, what the numbers mean, and what you can do about them. If you've had a calcium score test, you may have a number that you're staring at and just wondering, how do you make sense of it? Well, I've found that much of this information is easier to grasp visually, so I've created a short presentation to guide you through it step by step. Let's get started.
So before we understand what the calcium score test results mean, first we should probably start with what is a calcium score. So a calcium score, also known as a coronary artery calcium score, is a test that uses a special type of CT scan to measure the amount of calcified plaque that's in the arteries of your heart. So these are in the arteries on the outside of the heart. They feed the heart, and if they're blocked, oxygen and blood cannot get to the heart muscle and it dies, therefore heart attack. Calcified plaque can indicate coronary artery disease, or CAD, which is one of the leading causes of heart attacks. The more calcified plaque you have, the higher your calcium score and the greater your risk of heart disease. So now let's get into understanding the numbers and percentiles. So on the left-hand side, you're going to see the calcium score. The center will be the percentile, which is you against your peers. And on the bottom is the risk level. Now, let's talk about what those numbers actually mean. Your calcium score is going to fall into one of 5 categories. And I'll include the percentiles to give you a clearer view of how you compare to others in your age group. And that will be in that center column. So score of 0th percentile. This means there's no detectable calcified plaque. Your risk of having a heart attack in the near future is very low, but this doesn't mean that you're risk-free. We will talk about that later. The good news is that a score of 0 puts you in the 0 percentile, which means that you have less plaque than the majority of people in your demographics, age and gender. So moving to the second set of calcium score, 1 to 10. This would mean you're in the lower 25th percentile. So this is considered minimal plaque. Your risk of heart disease is still low, but some plaque is present. More on this later and how plaque can be in other areas of your body that can cause a heart attack or stroke. A score in this range often places you in the lower 25th percentiles, meaning people in your age group have lower plaque levels. So you're at around, say, up to the 25% of people in your age group with lower plaque levels. Now moving to the 11 to 200 score range. Now you're in the 25th to 50th percentiles. This means you have a mild to moderate amount of calcified plaque, not soft plaque, just calcified plaque. More on that later. Your risk of heart disease is increasing, and lifestyle changes are likely going to be recommended by your doctor at this point. Being in the 25th to 50th percentile means you have more plaque than 25 to 50% of people in your demographic. So it's important to discuss this with your doctor and see what immediate changes can be made to lower your risk of heart attack. Now moving to a score of 101 to 300. Now you're at the 50th to 75th percentile, and this is considered moderate to high risk. It's a significantly higher risk of heart disease, and a score in this range can often place you, in the more severe range. So this is definitely something where if you don't have a provider, you're going to want to get one and discuss with them an immediate care plan. A score over 300, moving up next, indicates a severe amount of calcified plaque. So it is a very high risk of heart attack and heart-related problems at this point. You typically would have plaque at higher than 75% of your peers, which is a strong indication of heart attack. So doctors at this point might prescribe surgery or statins, like a stent or statins. It's really up to them, but this is an action-oriented phase typically. In this slide deck, you can see kind of a visual representation of what it might look like at that point. So if you're in a score of 0, you're going to be here on the left column. And then score of 1 to 10, you might look something like this, where this yellow is showing a slight plaque buildup. And then score to 1100, we're getting into like moderate, and then moderate to severe over here, moving further and further along to a significant buildup. So it is important to visualize what could be going on in your arteries, because if prevention is what we're looking to do, then sometimes having these images can help us understand how necessary it really is to start either making lifestyle changes, or even to perhaps, have a stent or whatever it is that your doctor could recommend at this point. Do you remember when I said earlier that having no detectable plaque doesn't mean you're risk-free? Well, that's because a calcium score is great for detecting calcified plaque, but it doesn't show the full picture, because it doesn't detect soft plaque, which can be just as dangerous, if not more. So there is another test that you can do that can detect soft plaque and hard plaque and mixed plaque, so really just the 3 stages of plaque. And that's called a carotid artery ultrasound. And the benefit here is because a carotid artery ultrasound uses sound waves to create images of the arteries in your neck. These are the ones here on each side, and they supply the blood to your brain. So it's a powerful tool for detecting both calcified and soft plaque. Now, soft plaque is more prone to rupture, which can lead to a heart attack or a stroke. So detecting it early is really crucial. Carotid ultrasound is also non-invasive, doesn't have radiation, and it can identify risk of stroke and heart attack, where the calcium test is really only to detect later stage plaque. So it won't see it if you have soft plaque in your arteries, right? So let me just show you what that would look like. If we go back here and this is soft plaque, let's say you're at score 101 to 300, but let's say you got a clear score, a 0. That could be because you had this much soft plaque in your arteries and that hasn't yet hardened, Now, is it super likely that there's going to be a huge amount of plaque like this that hasn't calcified yet? Maybe, maybe not. But it's worth looking at your other arterial beds to see what's happening there and detect that soft plaque, which could be an indicator that soft plaque could also be in other arterial beds in your body. So by having a carotid artery ultrasound added to your calcium score test, like in addition to, you can get a complete picture of both soft and hard plaque in your arteries. This combination of testing can help guide your doctor's recommendations on whether you need lifestyle changes, medications, or further testing. Here at Atlanta Ultrasound, we do perform a carotid ultrasound test. We also include the highly sought after CIMT test, which if you haven't heard of, I'll link to a video to learn more about that below. Before we move on, I do want to quickly introduce myself. Then I'm going to get into more about these tests. I'm Bridget Hannigan. I'm a cardiovascular sonographer, and while I'm not a doctor, I do work in medical imaging and often find that patients don't always get the answers that they need after tests. So I'm here to help simplify things for you that your doctor may not have explained or may not have had the time to explain, and perhaps they did, and it was just way too much information for you to understand all at once. So everything I discuss with you here is not medical advice. It's just for educational purposes only. Please always consult a licensed medical provider for your specific healthcare needs on any testing you're going to do or avoid before making any decisions based on test results. Now getting back to the calcium score test and why I think it's not the only test someone should have, because it just doesn't tell the full story. Talk to your doctor first and foremost. If you don't have a provider, feel free to go ahead and find a good functional medicine provider or healthcare provider of your choice. I prefer functional medicine providers because they tend to be more preventive, so that's just my personal cup of tea, but of course, whatever is a good fit for you is the best one. Whoever you're going to listen to, that's who you want to be your provider. And then you're going to want to consider additional testing like carotid ultrasound, angiograms, stress tests, whatever your doctor recommends. And also keep in mind that lifestyle changes are your absolute first line of defense. So eating a healthy heart diet, managing your stress levels, even though you don't think you have much stress, trust me, you do, and whatever else we can do to, get and stay healthy. So I just want to tell you a little bit about Atlanta Ultrasound, our vision and what we stand for. If you like this video so far, I encourage you to stay and just take this moment to learn a little bit about us and what sets us apart. We are prevention-oriented, patient empowerment first, and education and accessibility by providing low-cost ultrasounds without a doctor's order. And we do not accept insurance, so you never have to worry about, having to be approved for something. Our vision is that we are prevention-oriented and seek to empower people to take control of their own health before problems arise by offering accessible and affordable ultrasound testing. We're insurance-free, which means you don't need a doctor's order or an approval for your insurance company in order to get the tests you need. And with Atlanta Ultrasound, you are in control. So feel free to visit us at atlantaultrasound.com. Check out our services, see if they're a good fit for you. We have plenty of people driving in or flying in from out of state to have the testing that we offer. So if you want to learn more about those services, I encourage you to, hop online and check that out. All right. I hope that this has helped you today understand your calcium score test results and educate you a little bit on other tests that are available and why having a 0 score is not a free pass saying that your arteries are free and clear. There is still more work to be done. All right, have a great day. And if you need to find us, just visit atlantaultrasound.com. Thanks.